Hi, I'm Steve Selig, founder of FitTest, and this is part of a small series on the topic of atrial fibrillation and exercise. In part one of the video series, I talked about what is atrial fibrillation and the commonly prescribed medications and why those medications are prescribed for atrial fibrillation. In part two, which is this video, I'm going to focus on atrial fibrillation for exercise professionals. And in part three of the video series, I'm going to present a case study or two. So first of all, clients presenting with atrial fibrillation to exercise professionals, there are some certain basic essential competencies that a professional needs when working with atrial fibrillation clients safely in an exercise setting. And one of the important things you need to be able to do is to be able to monitor and be able to interpret heart rate and heart rhythm in AF clients, both at rest, particularly before exercise and during exercise. And you need to really answer the question, is there adequate rate control? So radial pulse is one simple method. So what you would feel on atrial fibrillation through a radial pulse is that the pulse would be continuously irregular. So you would never sense that there was even an underlying rhythm of any kind. It would be a constant or continuous irregularity in the pulse rate, in the pulse feeling. Some of the pulse oximeters are quite good for detecting arrhythmias, particularly those that have a visual display of the O2 sat pulse. So this is not all oximeters, but some of them will display that quite nicely, and you'll get a sense of an arrhythmia. Brachial sphygmomanometry, which is a big, long medical term for taking someone's blood pressure with a cuff and a stethoscope. And when deflating the cuff between systolic and diastolic pressure, you'll be able to easily hear rate and rhythm and get a sense of rate and rhythm quite nicely in most people using this technique. Stethoscope for apical pulse, which is putting a stethoscope over the bottom of the heart and listening to the rhythm. Fast responding heart rate monitors, and most of the big companies do a really nice job now on heart rate monitoring and can be used to sense arrhythmias. And just to highlight that, if you look down here, this is someone in sinus rhythm. If you don't know what sinus rhythm is, that's a normal rhythm of the heart. And this is someone with higher heart rates in atrial fibrillation. And the one thing to notice, and I will talk about this in other video series, is that although someone has an irregular heart rhythm and high heart rates, the heart rates actually still continue to go up in response to incremental exercise test and then come down in response to recovery. So that's very common for people in atrial fibrillation. And this response to exercise is a good thing. Now, there are some single lead ECGs that are very simple to use, and there are quite a few companies there. I'm not here to promote any of the companies, but I will show you on the next slide an example of what AliveCor can do in the area of atrial fibrillation. You can do a 12-lead ECG, but this is very time-consuming and requires quite a lot of expensive equipment and know-how and a bit of expertise in interpreting. So this is not, I'm not suggesting or recommending this for you. Holter monitor, but this wouldn't be normally administered by you. This would be administered in a cardiology setting, but you'll be able to get the reports. Event recorders, similarly, cardiology intervention or recording devices, and again, you may be able to get the reports. But it's really also important to communicate with the patient's medical practitioners. So just some considerations for clients with atrial fibrillation presenting to exercise physiologists. If it is new atrial fibrillation, then do not exercise. So if you think that this is a new finding, do not exercise that client on day one. Refer to your emergency medicine hotline. In Australia, it's 000, but it'll be different phone numbers in different parts of the world. Or GP, general practitioner, the primary care medical practitioner. And this is an urgent referral if someone is in new atrial fibrillation. It does not matter what their heart rate is. If they have this continuous irregularity of the heart rhythm, you need to be doing something on that day. And I would recommend that you make the call to the medical practitioner rather than rely on the client to do that, because as we know, some clients will go into denial and simply go home and lie on the bed. Record if possible using an AliveCor. Now, paroxysmal atrial fibrillation is a medical term for little bursts of atrial fibrillation that have a spontaneous start and a spontaneous end. And in this setting, we want to be able to monitor and record both rate and rhythm. So rate is heart rate, so it's how many beats per minute, and rhythm is really just regular or irregular. And if it's irregular, is it irregular all of the time, such as in indicating atrial fibrillation, or is it only in an arrhythmia or rhythm disturbance for a few beats out of every minute, say, then they're more likely to be ectopic beats. So this could be, is the client in sinus rhythm? Is the client in atrial fibrillation? We're interested in whether exercise will trigger atrial fibrillation. So if your client is telling you that they're getting these symptoms whenever they exercise, that's certainly a red flag. Will exercise reduce the burden of atrial fibrillation? In other words, if someone does get fit, will they have less atrial occurrences of atrial fibrillation if they're in this paroxysmal area of spontaneous start, spontaneous end? Permanent atrial fibrillation are those clients who, as the name suggests, have atrial fibrillation 24/7. In this case, we don't really need to worry about the rhythm because we know they have the arrhythmia, and we're just really monitoring the rate and making sure that if the rate goes way too high against the guidelines, that you then report that to the primary care medical practitioner. Check that the medications and compliance to medications is happening. That was part one of this series of videos. Will exercise promote reversion to sinus rhythm? There's really no evidence for that, so we won't touch on that. Now, ablation, which is an intervention for atrial fibrillation, which I'll talk about elsewhere, this technique may be able to revert the person back to sinus rhythm, in other words, normal rhythm, or they may be paced with a pacemaker in that setting, just depending on what type of ablation therapy intervention they have. In this setting, you need to record rate and rhythm before and after every session using palpation or one of the other methods I talked about. And apart from comorbidities, you can measure exercise as for healthy individuals. So this is just the AliveCor example here, and clearly here you can see the arrhythmia for the ventricular beats, the tall spikes, the ventricular beats, and there's no rhythm to this at all, and this person's in atrial fibrillation. And this lovely, fairly inexpensive device, AliveCor, with the Kardia with a K app, which is free for your smartphone. So the Kardia app is free. AliveCor you need to purchase. It looks a little bit like this. It fits on very nicely onto a smartphone screen. It can sit behind the phone, but I preferred actually to have the device separate altogether from the phone. But you can easily get from the AliveCor website information on this. And this has been approved by the medical authorities, both in Australia and the United States of America. So that's really all I wanted to say in this part 2 of atrial fibrillation series of videos, short videos. If you would like to get in touch with me to ask me about anything of this, by all means, email me at info@myfittest.com.au. Thanks for listening and have a great day.